Hello, this is Dr. Paul Evans again in part 2 of Training Osteopathic Primary Care Educators, Academic Survival. In part 1 we talked a little bit about the pathway of the physician who wants to go into academic medicine in a College of Osteopathic Medicine position. In part 2 we're going to describe the osteopathic graduate medical education pathway. What are the things that you need to know to understand the skill sets and the processes for succeeding and surviving as an osteopathic faculty member. The common career pathways in osteopathic academic medicine, in fact, in the OGME path, are first of all becoming a faculty member, and there are various ranks of clinical faculty in OGME pathway positions, the assistant professor, the associate professor, and then the full professor. There are other unique positions in OGME. There's a clinic director position that commonly occurs, a residency program director, a department chair, and then the director of medical education. And we will cover all of these and give you a sense of what's required for each position. In the OGME path, every physician faculty member must have an osteopathic residency or a fellowship and have been board certified by the American Osteopathic Association. But in this pathway, there's more emphasis on teaching and service versus scholarly activity that occurred in the predoctoral COM pathway. The pathway is non-tenured. Scholarly activity is still expected for faculty members in residencies and fellowships, but fewer publications are probably required in order to be promoted. There is more focus on specialty presentations at regional and national levels, and so if you're going to be successful in this pathway, you're going to have to be a very, very good presenter. Leadership is very important in clinical organizations, particularly at the regional and national level. This is the way that you participate with your peers in your specialty around the region and around the country. And medical policy knowledge is also required because a lot of the leaders in the OGME, in fact, are responsible for defining policies for residencies and fellowships and those types of things. And last but certainly not least, all faculty members in this area must have good skills in assessing the competency of learners at all levels. So you will be expected to assess the competency of students, of residents, and of fellows, and also of your peers. Okay, so here again is to be a clinical faculty member, rule number 1 is you must be an excellent osteopathic physician. That's the same rule that we saw in the COM pathway, and it's true. If you don't have the respect of your fellow physicians, you're not going to be successful. You also have in this pathway an increasing emphasis for getting grants for clinical studies. There's an increased emphasis on publications more in clinical journals. There are similar milestones to the COM pathway in comparison. And the emphasis, as I mentioned, was on clinical teaching and on clinical skills. Again, you have to be an excellent physician, so to start out as a clinical faculty member, you must be proficient in your specialty at a minimum. All right, how about residency program director? What does it take to be a successful residency program director and to survive in this position? Well, a residency program director, first of all, must be a very experienced clinical teacher. They have to be a respected leader, and they have to have very, very good clinical skills. Most residency program directors who survive are expert or masters clinically, and they become what I call a doctor's doctor. So that's the person in the program that all of the faculty want to take care of their family members or to take care of them. And if you see that happen in a program, you know that person has a lot of respect from their faculty and from the people that are in their program. Many residency program directors have additional graduate degrees, a master's in science, a master's in education, an MPH, a fellowship, other extra credentials. Those things separate the competency and the skill level of a residency director from other faculty members in the department. Scholarly productivity is a part of the requirements of being a successful residency director. You also probably need to have some national level presentations under your belt in order to credential yourself as being a competent residency program director. Additionally, a program director also has other skill sets that are important besides just being a good clinician. There are skills in administration, in recruiting residents and faculty, in curriculum development, in individual rotations as well as the program, in being successful in taking the program through accreditation processes, an assessment of peers, of teaching, of residents, of fellows, of students, and also in organizing and administering remediation programs for those learners that are having difficulty. And last but certainly not least, there is a strong need to be successful in professional interactions with other programs in the hospital and with other program directors in the same specialty elsewhere. All right, how about the clinic director? Well, this should be an experienced clinical leader. So it's someone who's been in the program for a while, who understands the nuts and bolts of how the program works. Strong organizational skills are needed and strong planning skills are needed, because this is a person that in fact defines the running of the clinic. So this person is involved in scheduling physicians and clinics for residents and fellows and so forth. They make sure that they oversee the billing and the coding to keep all the financial aspects of the clinic moving in the proper direction. They look at efficiency, they look at budget, they are responsible for evaluating items that need purchasing, and they also look at room assignments to make sure that there's efficiency in the clinic to take care of the needs of providing medical care in the program. The clinic director also supervises a number of non-physicians, and that means that they have to have the ability to hire and fire, do appropriate counseling, understand the intricacies of HR. I mean, all those things are important. The clinic director also balances the educational needs of the program with the productivity needs of the program. And that's actually a tension that's important to understand in looking at departments. You do have an educational aspect, but you also have to make sure that the clinic runs efficiently and can pay the bills and make sure that the budget is on time and everyone's salary is paid, and the clinic director is the person that helps do that. And last, the clinic director is responsible for managing the resources in the clinic and making sure that what people need is balanced with the ability of the clinic to be able to afford the things that are requested from the clinicians. All right, the top level position in a department is the department chair, and this is a senior physician and manager. That person usually has a national level reputation in their specialty. So it's important that if you want to have that position, you have to develop those abilities. Usually the department chair comes out of a program director position, either in the same program or at another program. They're at an associate or a professor level. They have strong skills in leadership, in administration, in communication. So they communicate not only above them to the CEO of the hospital, to the chief medical officer, but also below them in the department itself, with the nursing staff, with the front desk staff, with all of the people that are involved in the department. They have strong negotiation skills. Usually they're required to do things like hire and fire, have salary negotiations, those kinds of things. They do long-range planning not only in the department, but they participate in that in the hospital, so it's important to have those skill sets. They have to be very skilled mentors because they work with not only their faculty, but also the residents and fellows in their department. And they should be very skilled in looking at faculty and staff development processes to take people in their area and to move them up and give them additional skill sets so that they can grow and advance on a professional basis. The department chair also supervises the program director and the clinic director. And so that person is really responsible for understanding both of those positions and then working together with those individuals. Okay, so that's a lot of skills, and it requires a lot of time and a lot of experience to get the competencies that you need to be successful and to survive in these positions. So how do you do that? Well, there are a number of ways. One of the ways that you can get these skills is actually to take a formal program and to look at graduate degrees. And so there are a number of programs that are available with master's degrees in education. MPH, a Master's of Public Health, is a very common add-on degree that physicians get in order to understand some of these concepts. A Master's in Medical Management, an MBA, all of those things are credentials that you can consider to develop some of these academic and administrative skills. There are certain postdoctoral fellowships that are available. Some faculty development postdocs, teaching scholars programs, fellowships that are involved with various organizations, Costin. There are a number of programs that are very good. All of those are helpful in getting these types of skills. Faculty development workshops and programs similar to what this presentation is a part of are important ways that you can learn about these processes. Specialty organizations have some specialty-specific programs. For example, there are abilities to get some of these skills through committees, through organizational work. One good example of that is to be on the program committee of various conferences and annual activities so that you understand how it develops and what things are needed to run a program, to put up a curriculum for continuing medical education and so forth. On-the-job training is a good way to get these skills, but more and more as time goes along, people who are hiring for these positions really want to have a little bit more formal experience from the candidates that they're interviewing to make sure that the skills that are required for positions have been learned by the people that are involved in these jobs. Okay, so other things, you can get an MBA and an MMM. There are committees in the department and the hospital that you can participate in, which are very, very helpful for learning some of these. And I would encourage you, if you have an interest in getting some of these senior level positions, to participate in budget committees, in practice plan committees, in long range planning. All of those things give you experience that can help you to look at how organizations are run and what factors are involved. Other processes include becoming a project officer for such things as quality assurance, utilization management, being on the JCO preparation team for inspections, the Electronic Health Record Committee. All of these committees will give you valuable experience in looking at how various aspects are administered and planned for in your department and in the hospital. Now, to get all these experiences and to still practice medicine and run a residency program or participate in these graduate programs is very difficult. And there are lots of obstacles where physicians who are looking at transitioning into academic programs just kind of shake their head and they say, how am I going to be able to do that? And the number one obstacle that I hear from junior physicians who are considering an academic medicine career is, my God, how am I going to find the time to do this? I have to get new training. I have to understand the process of research and doing presentations. If I spend time doing these things, my department chair says, well, you're not making money for the department seeing patients, and so it's a real trade-off to get the time to be able to do that. And additionally, I really need to find a mentor or a coach that's going to help me to learn these skill sets, and those are very difficult. So what a person needs to do if they're looking at an academic career is to look at all of these things to say, I need to get started early, get some expertise, get some mentoring so that people can actually help me to make a plan and to get started in this process. Another obstacle has to do with conflicts, and this is not uncommon. There are a lot of conflicts with some physicians who are hired into a position and suddenly you want to advance, you want to get skill sets for other areas, and your supervisor is not really enthusiastic about what your professional goals and objectives are. So you're going to either have to adapt and do these things in the context of an environment that's difficult for you. You're going to have to negotiate for change in what you're doing now versus another process that can help you to advance your skills, or you might even have to contemplate leaving and going to another place that is a little more friendly so that you can do the things that you need to do to get these skill sets. Another process that's very, very common for physicians is this balance process and avoiding burnout. And that we are so busy and do so many things, and there's so many people that are trying to get our time that sometimes it's a real struggle to get everything done and still meet your own personal and professional needs. And so one of the skills that's really important as you develop is to be able to say no to people and not take on additional activities that might not necessarily help your career. So that focus process is something that has to be individualized, and sometimes it's okay to say no to people who are trying to get your time and then say yes to doing the things that are more important for your professional growth and development. Personal time is important, and those people that are successful in fact schedule their personal time, and they make sure that there's time for them for exercise, hobbies, meditation, relaxation, all of the things that keep those batteries charged so that you can do the things that you need to do in your professional life. And understand too, in today's environment, sometimes in order to get promoted, you're going to have to plan to move. You might not necessarily advance all the way from a junior person to a senior person in the same program. Actually, in today's environment, that's very unusual. So part of this process could be that you're going to have to move to another institution in order to get a promotion to a higher level. All of these topics are probably future topics for faculty development, but if you're considering this transition into an academic program, the time to think about these things is early. So in summary, academic medicine, in fact, is not just clinical practice. There are defined skill sets in teaching, service, and scholarly activities in both pathways, in the College of Osteopathic Medicine pathway and the Osteopathic Graduate Medical Education pathway. Promotion and advancement require increasing competency in both clinical and academic skills, and to survive in this environment and to be healthy, you must learn to obtain these skills and overcome the obstacles which threaten career progress. Thank you.